you all for coming in on a Friday evening. It's an interesting time to be having a webinar, but considering that it's lockdown, it's also very interesting to be having a webinar right now because we are all confined to our homes. And today we have a very interesting speaker with us, Dr. Hari Kumar. He specializes in psychosomatic disorders and its management through Ayurveda. Most of us tend to associate Ayurveda with somatic or physical disorders or diseases, and psychosomatic brings in a very interesting and new perspective. Probably not new, a very age old, but new for a lot of people, such as myself, because I associate mental well-being more from the yoga perspective. A little about Dr. Hari Kumar. He's been teaching, and he's an Ayurvedic physician from Kerala. He's been in India and across Europe. He's been practicing for over 20 years. He completed his training from University of Heidelberg, Germany, where he specialized in medical anthropology. And he currently works as a superintendent in NSS Ayurveda Hospital in Kerala. And he's also pursuing his PhD in VU University, Amsterdam. So, as a holistic practitioner, he's also had a very holistic experience across the world. And with this said, we're going to ask Doctor to share his experience on what brought him to Ayurveda and how can he enlighten us on this whole perspective of psychosomatic disorders.
Thank you, Arjun, for that kind introduction. So first I will chant a prayer. Om Shankham Chakram Jalukam Dathat Amrita Khadam Charu Dorphi Chaturuphi Sukshma Swachhanu Hridyanshu Kapari Vilasan Maulimam Bhoja Netram Kalambhu Dujvalangam Katitata Vilasat Chatu Pitambaratyam Vande Dhanvantarim Tam Nikhila Gadavana Prautadavat Nilinam. It is a prayer to Lord Dhanvantari, the healer god or the god of healers. Yeah. So I'm very delighted to speak to you all this evening, especially so because I'm speaking on one of those topics which touch my heart and soul. And it has been very special journey when it comes to psychosomatic disorders. So as soon as Arjun was talking to me about this, I was immediately accepting this invitation to speak and also suggesting psychosomatic disorders as the topic. My journey of dealing with psychosomatic disorders started way back in the year 2000, which is 21 years back, when I was completing my graduate program in Ayurveda from Government Ayurvedic College in Trivandrum and starting my practice. Along with my practice, I was also teaching an introductory Ayurveda course to international students at a Center for Cultural Education in Kerala called Jnana Kalavedi, and it was accepted and accredited by the government of Kerala as a cultural education institution. So I started having patients and also students from across the world, even at that point. And I confronted my first fibromyalgia patient in that cultural center. I'm not sure how many of you are aware of this particular term, fibromyalgia. Fibromyalgia is severe muscular pain associated with chronic fatigue. It's otherwise called chronic fatigue syndrome as well. And it is mostly stress-related chronic muscular pain. But it is not just limited to that. It affects many aspects of your functional life, including your clarity of the mind to take decisions. You call it the fibrofog. You have a foggy mindset. which stops you from taking decisions. So my first fibromyalgia patient was from United States and was a Grammy award-winning musician. And confronting her and her symptoms, I was quite clueless because I did my Ayurvedic education in Government Ayurvedic College in Trivandrum, which has at any point and even now minimum 800 patients as for inpatient treatment. At any point of time, more than 800 patients stay there. And even then, I never came across a fibromyalgia patient, not just during my student life, but also in my internship period. So it was the first fibromyalgia patient I was confronting. So I had a look at the medical textbooks in 2000, which is 21 years back, and nothing much was written on this topic. And then I decided to refer her to one of my mentors, Dr. Rajagopalan, who was a Padma Shri. He was awarded the highest civilian honor in India by the government of India for his contribution towards medicine. He was a doctor in modern medicine as well as in Ayurveda. I took the patient to Dr. Rajagopalan, and he was very kind to give me an insight on fibromyalgia. And he actually told me to open the textbook Ashtanga Hridaya, which is like a Bible of Ayurveda in Kerala. You know, we follow the Ashtanga Hridaya, the textbook called Ashtanga Hridaya, which is written in Sanskrit, which is often followed in Kerala. So he asked me to open the text, and he narrated the symptoms which are explained in this textbook for Mamsa Meda Gata Vata Vyati. So it's a Vata imbalance affecting the muscle and the fat tissue. Yeah. So it is not said psychosomatic in Ayurveda. Ayurveda say it is a Mamsa Medo Gata Vata Vyati. It's a Vata imbalance affecting the Mamsa Dhatu and the Medas Dhatu. And he said, from the text, asked me to read it. And the text said, Mamsa Meta Gato Grandhin Todathyan Karkashan Brahmam Gurvangam Cha Atiruk Staptham Mushtidanda Hatopamam. Unquote. So this Sanskrit text says, if you have a Vata imbalance affecting your muscle and fat tissue, you will have Grandhi. Grandhi is like an abscess. Toda, severe pain. Karkasha is like you are squeezing pain. Brahmam is something like vertigo. It also could be a problem with consciousness. Gurvangam is like heaviness of the limbs. Atiruk, very severe pain. Stapthada is like you are startled, you know, you're blunt. Yeah. So it could be like you are having a blunt appearance. Mushti danda hadopamam is, mushti is your fist. It is like the pain as if you're fisted. So these are the signs of Vata imbalance affecting Mamsa and Medo Gata Vata Vyati. And he said, open the other pages, and he also narrated the treatment of this problem. Vireko mamsame daste niruha shamana nicha. That is a treatment principle. Vireka is like purgation. Niruha is like emulsion or decoction enema. And shamana is the balancing treatment or dosha balancing treatments. So this is the dictum of the Ayurvedic management of fibromyalgia. As he said, there is nothing much in this as psychosomatic, I can tell you. But fibromyalgia is a psychosomatic problem for which the treatment is very tricky and which is very difficult. When I have been teaching, I have come across medical doctors lately in my career. In 2008, there was a Prince Charles Foundation Ayurveda study to Kerala, in which I was one of the faculty members who were lucky to introduce Ayurveda to the 20 odd general practitioners from UK who visited Kerala to learn the basics of Ayurveda. So then I discussed this point with one of the doctors, and he said, when I see a fibromyalgia patient, my heart sinks, which means he has nothing much to offer to the fibromyalgia patient. I think this is the same with the general practitioners and modern medical doctors, many of my colleagues in many parts of the world. As I also traveled to Germany, and I had been working in a neurology and complementary medicine unit in a hospital in Hattingen, which is near Bochum. Yeah. So there, I have seen many patients also, and nothing much could be offered from the medical side to this problem, as it is a lacunae which is not that much well understood and well treated with the modern medicine part of it. So initially we started having patients mostly from Europe or the United States, and lately we started having patients from our own village and from our own locality having these problems. And we have been having several inpatients having this particular problem and treating them. So my experience in treating fibromyalgia says, often you have patients having often a trauma, and then following the trauma, it need not be always such a severe mental trauma, but often it is a severe mental trauma. But you can also have a physical trauma which is followed by a lot of stress in your life, and they start having what you call the myofascial cycle. And then you have severe muscular pain, and which lead to insomnia, and insomnia in turn lead to again spasm, and again severe muscular pain and insomnia, and it goes on and on. It's a vicious cycle. So they find it pretty hard to have a proper sleep rhythm, and they find it pretty hard to come out of the severe painful experience. And as I mentioned earlier, you have the fibrofog and difficulty in clarity, and so on and so on. So the Ayurvedic approach to treat it is mostly with, as I mentioned earlier, panchakarma, as we call it, purificatory treatments. Videchana or purgation is the first step. Niruha or enema treatments is the second step. And still, the remaining dosha, the dosha shesha we call it, have to be balanced with further pacificatory treatments according to the Ayurvedic principle. So we have been doing this and delivering this all through in our inpatient practice and our experience. And if you ask me, is it totally or completely curable? I will not have a tall claim and say it is completely curable, it's easily curable. So no, that is not my answer. It is manageable. The pain is possible to be reduced. The situation is possible to be improved, but it is a long process. So often these patients repeat their visits, they repeat their treatments, they take some digestive medicines, because often your digestive system is affected when you have fibromyalgia. So they need to be on a special diet, and the fitting steps, as Arjun said, yoga and pranayama always helps to improve our fibromyalgia patients. So when they have a yogic schedule and also pranayama, we find there are improvements in their pain situations. So altogether, these function of treatment works. So it is important, because normally in the normal modern medical therapies as well as treatments, nothing much works for fibromyalgia. So I was interested in fibromyalgia, and then I had a look at, or incidentally had a lot of other patients coming to me, like common day-to-day practice. And for your information, I'm also mostly like doing a GP practice, a general medical practice in Kerala. I'm also in charge of the hospital, so I'm more a GP. But my focus is partly neurological and partly this psychosomatic cases. So we often have in our general practice several other situations of psychosomatic disorders. So I started having a look at these problems like irritable bowels, ulcerative colitis, insomnia, skin disorders, so on and so on. And often we see that many of these problems do have a psychosomatic angle. They are not just purely based on a physical reason. And also Ayurveda's outlook in treating problems in general is threefold. It is not just the physical management of disorders. We believe in Deva Vyapasraya, Sattva Avachaya, and Yukti Vyapasraya. Deva Vyapasraya is like a spiritual or divine healing. We say Mani, Mantra, Aushadhi, Beli, Upahara, Prayaschitta. It's a long list. Mani is like healing gems. Mantras are the use of mantras. Aushadhis are not just medicines taken in, but amulets of herbs which you wear on your body. Beli is like sacred offerings to your ancestors. Upahara is like gifts given to deities or gods. Prayaschitta is when you do certain rituals for giving in to gods or deities for your mistakes, so on and so on. So this is the line of management which you call the Deva Vyapasraya, which is divine or spiritual way of managing illness. Then you have Sattva Avachaya. Sattva is your mind or your mental situation, and winning the mind. You wear an amulet. See, I have a thread on my hand. It is a Sattva Avachaya, yeah, because it helps me to have this feeling that I am protected. So something which wins your mind is called the Sattva Avachaya Chikitsa. And Yukti Vyapasraya is like based on your Yukti. Yukti is your reasoning or your logic. So you have dosha imbalance, and why the doshas or the humors are imbalanced, and you have a logical reason for that. Which foods cause this imbalance, avoiding those foods, using the opposite qualities in foods and medicine to balance this imbalance. This is mostly logic and reasoning, and this is what you call Yukti Vyapasraya. So Ayurveda has in store all these three approaches of management, and we do employ and we do believe in these three ways of approaches as well. But see, in the case of fibromyalgia, we have been following the psychosomatic disorder, interestingly, from a more somatic angle, and then coupled together with the other aspects, the Sattva Avachaya, and then also Deva Vyapasraya. And as well, as we said, as a part of Sattva Avachaya, I consider yoga as well as meditation and pranayama and all that, because it's also helpful for the person's mind. But more than Sattva Avachaya, as Arjun has been rightly pointing out, the importance of yoga, I am also an ardent believer that pranayama and yogic steps have a lot to do with this. And I would like to stress on this, your Yoga Sutra saying, Chale vade chalam chittam, nischale nischalam bhavet. Yogi sthanutvam apnoti tato vayum nirodhet. So why you have to do pranayama? Your mind is wavering when your breath is wavering. And when your breath is controlled, your mind is also controlled. And yogi is of the position of a sthanu. Sthanu is a pillar made of stone. So the yogi is a stone pillar, so stable and steady. And thus you have to do pranayama, says Yoga Sutra. So I completely believe and respect the effect of pranayama in managing all the psychosomatic disorders. And personally, I'm not a yoga teacher, but we do have yoga teachers employed as a part of our hospital's total program. And so we invite them to intervene and help these patients when they are coming in. So starting from fibromyalgia, as I said, our journey started with treating psychosomatic disorders. And we do see digestive problems like irritable bowels and ulcerative colitis on a daily basis in our practice. They are also clearly psychosomatic problems. Irritable bowels, we call it grahani in Sanskrit. In the Ayurvedic textbooks, we have reference to the condition called grahani. And colitis also, we often have several cases of colitis coming in. Colitis is the inflammation of the large intestine. As you can understand, it is the inflammation of the colon. And often you have bleeding and you have mucus discharges and so on and so on. They are all seemingly very physical problems, but they have deep-rooted reasons in your mind, and it is mostly psychosomatic. I often observe that people have who have irritable bowels are mostly people having anxiety problems. Those who have anxiety disorders tend to have irritable bowels, and those who are deep in their thoughts and those who are very much affected by stress often are having colitis, and deeply stressed and deeply troubled minds often get colitis, in my opinion. And similar is the case with insomnia. We have been treating several cases of insomnia, and insomnia also responds well to Ayurvedic managements, including Panchakarma. We do the stream application on the head and so on and so on, several other treatments, lepas on the face and the feet, and some types of massages and all that. So we do treat these conditions also with Ayurvedic treatments, but at the same time, as I mentioned earlier, with other effective managements of Sattva Avachaya, Yoga, and also Deva Vyapasraya. Then skin disorders. We see a lot of skin disorders are related with your mind and often psychosomatic. And lately, we have been into autoimmune disorders. And we, as I said, I'm mostly a generalist, and I have been seeing also a lot of autoimmune disorders. And many of these autoimmune disorders, including rheumatism and systemic lupus and psoriasis, all these have clear psychosomatic angles in my experience. Normally, I tend to tell my patients having psychosomatic problems, I try to discuss with them their stress. I think, and also it is very interesting, people, when they start speaking out, they start what you call in the language of psychologists, they start ventilating. I think a lot of healing is also starting in. And so this ventilation time is much less in the medical settings. You have an N number of patients, and you have very little time to each of them. So this kind of a ventilation and a person-to-person approach and care is already lacking and missing in our medical practice these days. And second point is the lack of compassion in many of the medical practices. So if you have an empathy and compassion, and especially if you are willing to hear when some of your patients are ventilating to you, I think we can offer a lot to these patients. And you can also go deep into the stressors, which could be familial or social and so on. And this is then easily helped, when you can also intervene and suggest some improvements and some situational changes and so on. And I think this has been working in most of our patients. So I will say respiratory problems. Some of the respiratory problems are also psychosomatic. So I have seen patients who complain of situations very similar to asthmatic attacks. But when you do the investigations, they don't have anything like allergic situations or particular asthmatic conditions, but it is mostly psychosomatic. And we have patients who have panic attacks. Myself, I had a lot of panic attacks, especially after the passing of my elder brother. I had a series of panic attacks. So it was very interesting, and I tell this story to a lot of my patients as well. So when I have this panic attack, I feel like I will die the next moment. And when I'm driving, I have to stop. I take a breath, and I have to stop the vehicle, walk a few steps, and then come back to my body, and then only I can proceed further. So this was what I was doing. On a fine day, at night, I had a panic attack, and I was walking. And normally we do the Dhanvantaram Gulika. Dhanvantaram Gulika is an Ayurvedic tablet, which is maintaining the Vata flow normally in your body. Yeah. So I was putting a Dhanvantaram Gulika under my tongue and walking many, many steps in my home. And then my elder son was so young. He was just like 1 year old. And my wife it was midnight. So my wife opened the door, seeing me walking, and she came in and she said, "So you are supposed to protect me and this child. So if you are yourself so panicking in life, how could you protect me and this baby?" And so that was like a dawn on my head. And so I never had panic attacks thereafter. So I will say that was the best treatment. No counseling, nothing. It was just a tuck on my head, and I was finished with the panic attack. I tell this story to many of my patients too. So this is, you may wonder what is Ayurvedic in it. Yes, there is something Ayurvedic in it. We call it trasana in Sanskrit. Trasana is like startling. You make a big fuss and you startle the other person. Yeah, it is one of the management techniques of balancing Vata. Yeah? In the Vata balancing treatments, when Ashtanga Hridaya speaks on it, Veshtanam Trasanam Sego Madhyam Paishtiga Gaudigam. It says in the Vata management protocols, one of them is Veshtanam. Veshtanam is like doing bandages, ligatures or bandages is Veshtanam. Second one is one of the other management methods is Trasanam. You startle someone. So I was startled well by my wife that night after my brother's passing, and I never had panic attacks thereafter. So Ayurveda asks it's a funny story. It asks to bring someone near a well and startle him like you will be pushed into this well. And I don't think this is feasible now. You will be charged for a crime these days for such a unfounded ways. But I think there are psychological ways by which you can still do this. You can knock the person, make him aware of his duties, roles, and responsibilities. And we have been doing some of these kind of interventions also in our practice quite effectively. So this is like the long list of psychosomatic disorders going on. So basically, our management is mostly medical panchakarma, which is purificatory, and then, as I said, coupled with spiritual managements. We ask them to have certain dietary observations on some days, as well as some rituals or some penances to temples, etc. If they have a particular faith or belief in those things, we ask them to do that. At the same time, we do yoga and so multifold approaches, holistic, as Arjun has been speaking, holistic approaches we practice. I had patients who had been grieving of their near and dear people's deaths. Yeah. So this grief of losing a family member of a long term has been the reason for many of their problems, and we have been quite successfully doing after death rituals for them. And if they believe in one particular ritual faith or whatever, we help them to do the after death rituals in that particular tradition. And that is often found to be very helpful for these people to heal their problems. I remember I had a patient whom I consulted in Spain, and she had a very deep problem, and I observed from her pulse that the problem is very deep. Yeah, the imbalance is in a majja dhatu. And when I discussed this, that your problem is very deep, and I think it is somewhere deep in your body you have a problem, she confessed. I mean, she said, I have a problem in my bone marrow. You know, she has a bone marrow cancer for which she has been ongoing with her treatments. And then she said, 5 of her relatives, one is her mother and 4 others are her siblings, they all passed away having bone marrow cancers. And she kept all these 5 people's ashes in her household, and she is just living in the same premises. Can you imagine? 5 of your very dear and near relatives are lost, and you live with their ashes, and you have the same problem. Can you imagine? Can you come out of this problem like that? I said, no, you are not going to come out of this problem. So I tried to convince her to bring those ashes to the favorite place where they were spending their family vacations all together, and do a ritual and spread those ashes in nature and have a ritual performed of their own faith or whatever ritualistic tradition they have. And she did that, and she has been recovering quite well from this. I haven't heard of her from her for the last few months because of this COVID turmoil, but I'm damn sure that she is doing well. So not just with per se psychosomatic problems, but also in many other conditions of the human disorders, we find this psychosomatic approach, or rather the holistic approach, very, very interesting. And I have to speak a little bit on autoimmune disorders, and then I will conclude and we will go to a discussion. About autoimmune disorders, what I have to say is what Dr. Dr. B.M. Hegde has been telling us. Dr. B.M. Hegde said, your body has 120 trillion cells, and all of these cells love each other, and they also love the other person's cells. Yeah. So we have 120 trillion cells in our body. They love each other, and they love other person's cells as well. But when your mind plays a trick, yeah, when your mind tricks you, and say the other person is your enemy, your cells, especially your immune cells, go to a deep state of confusion, and they don't know who are your friends and who are your enemies, and they start attacking your own body's cells, and that is when the autoimmunity starts. Yeah. So this is not my theory. This is the theory put forward by Dr. B.M. Hegde, who was the Vice Chancellor of Manipal Academy of Higher Education, and who is a renowned cardiologist and a modern medical doctor. He is still in practice in South India. So it is his opinion. And when I followed this opinion, I was also not completely convinced, because I have fibromyalgia patients who are psychosomatic. I know this, but I have rheumatism patients, I have psoriatic patients, and so on, who seemingly have very clear physical reasons for their illness, even according to Ayurveda. So I was not a complete taker of Dr. Hegde's philosophy in autoimmune disorders. But lately, when I discussed this with my autoimmune patients, I slowly started finding this very convincing. Like, I had a very interesting experience which happened in Doha in June 2019. I was coming back from Europe from my PhD visit to Netherlands, and I was in Doha for one day, and I visited an Indian expatriate family having a child who have an autoimmune scleroderma in Doha. So this child have a scleroderma affecting her upper torso, but at the same time have disorders of growth disorders. And she has a younger baby and almost 3-4 years younger to her, but they both are at the same level of their growth. Yeah. So it's like she has a growth problem, which is like making her 3 or 4 years behind. So when I consulted this child having autoimmune scleroderma, I looked at all her case reports from her medical doctors and had a good discussion about her diet, life, all these parameters with the parents. And I was wondering, what is the relevance of Dr. Hegde's theory in this? How come this 7-year-old child have that kind of an interpersonal problem or a psychosomatic problem, even a familial problem, so on and so on? And I said, no way. It is not anything related to that. But then I just discussed this point with the parents and I told them, well, look, autoimmunity is said to have such a link to your stress levels. Do you think anything similar is feasible? Anything similar is applicable for this child? Then the mother went into tears and she was weeping like anything. And she told me, see, she had a clinical depression when she had the second baby. Yeah, she had been going through clinical depression, having her second pregnancy, and she was kind of ignoring the first child because of this. She could not perform the motherly duties. So the father, who is an expatriate working in Doha, had to clean the baby before he is going to his work. And until he is back, often this child is not given food, nor she is cleaned, nor her request for the motherly affection and care was maintained. So this is such a horrible situation the child went through when the second baby was in situ. She was pregnant. So I clearly understood that this was often the beginning. This was for sure the beginning of the scleroderma and the stunted growth of this child having autoimmune scleroderma. I had patients who had autoimmune liver disorders because of her anger, which she could not express at her workplace. And this anger, because of interpersonal conflicts at the workplace, giving her autoimmune liver disorder. And the patient came to us who was treated with Ayurvedic medicines as well as what we discussed, the Sattva and yoga and vegetarian diet and all these things. And she was recovering totally from the autoimmune liver disorders. She stopped her hormonal medications and so on. And she had to leave her work. And now she's a coach, a speaker, a public speaker, and also anchor and so on. So she left her full-time software job to be an anchor and a public speaker because of the reason that she could not manage the stress which was giving her this autoimmune liver disorder. So many of these stories and experiences tell us that autoimmunity is also clearly related with psychosomatic situations, especially related with your mind and interpersonal issues and societal issues, familial issues. All these should be taken care of when you are treating these kind of problems, especially autoimmune disorders. Now, I will just have a word on the Ayurvedic approach and then I will conclude. If I start to speak of what Ayurvedic lore has to speak about mind and body, I think I will exceed the time limit. So I will not do that. I will just quickly reflect on it. Ayurveda says, Manas Sharirayo Stapaha Parasparam Abhivrajed Athara Adheya Bhavena Taptajya Khatayuriva. Body and mind are extensions of each other, like the Tapta Ajya. Tapta Ajya is a warm ghee, and the khata is the container in which it is kept. Just like the container and the warm ghee in it, they share their radiance. They share their radiance. So nothing is totally physical, nothing is totally mental. Yeah. So it is actually above that as well. As we know that Ayurveda say you have the not just the body mind, but you also have the Atma. Yeah. You also have the spirit or the soul. The spirit, Atman is there above the body and the mind. Yeah. Sattvatma sharirascha trayam etat tridandavat, says Charaka Samhita. Sattva, Atma, and Sharira are the tripods, are the three legs of the tripod, says Charaka. So you have a physical, mental, and spiritual dimensions, yeah, which is according to Ayurveda. And then, interestingly, I will say most of your problems related with mind and also psychosomatic problems, according to Ayurveda, are because very simple reason: ishtasya alaphat anishtasya laphat, which means ishta means something which you like. You don't get what you like, and anishtasya lapha means you get what you don't like. Yeah, like situations in life, partners, wealth, parents, father-in-laws, whatnot. Yeah. So you so ishtasya alabhat anishtasya labhat. Yeah. You don't get what you like, and you often get what you don't like. Yeah. So this is considered to be the main reason of stress, as well as many of the mental problems, according to Ayurveda, very interestingly. And then together with yogic philosophy, Ayurveda also say of the sattva, rajas, and tamas, the three aspects of the mind. And sattvika, sattvam lekhu prakashamishtam, says Sankhya Karika. Sattva is light, bright, and love. Yeah. So the brightness, lightness, and the love has to be there for someone to be sattvic. And so this sattvic aspects have to be emulated also in dealing with sattva and also in dealing with treatment of psychosomatic disorders, according to Ayurveda. And I will conclude my whole discussion saying what Ayurveda say of treating with psychosomatic, not just psychosomatic problems, but mostly mind-related problems. It says, Dhi dhairya atma vijnanam mano doshaushtham param. Dhi is intellect. Having the intellectual capability or nurturing the intellectual capabilities. Dhairya is stability and strength. And Atmadi Vijnanam. Atmadi Vijnanam is knowledge on the self, knowledge on Atma. So these are the three main methods of healing problems of the mind, or most of the problems of the mind, says Ayurveda. So I will conclude saying, Bhishajam Satuvritanam, Bhadramagama Shalinam, Abhyasta Karmanam, Bhadram Bhadram Bhadrapilashanam. Satuvritanam Bhishajam Bhadram. Let good things happen to all the noble Pishaks, the healers, who live the life of Sathus. I think today's healers or doctors are not mostly living the life of Sathus, but in yesteryears, they were living life of Sathus. So anyway, yogis and healers, whoever they are, let good things happen to them. Bhadramagama Shalina. Let good things happen to those who would like, who learn knowledge streams to help others. Yeah, Agama is Vedas, knowledge. So let good things happen to those who respect knowledge. Abhyasta Karmanam Bhadram. Let good things happen to those who do their daily practice to sharpen their skills to help others around them. And Bhadram Bhadra Pilashanam. Let good things happen to those who would like good things happen to others. Yeah. So I think Arjun and Anurag and all the organizers of Sarveda found someone who is crazy sitting somewhere deep in a village in Kerala because of their Bhadra Pilasha. Yeah, because they would like good things happen, not just to them, but for everybody else. And also for me, I think. So that is why they chose me, they found me, and they coaxed and pushed me to do a webinar like this. So they are Bhadra Pilashis. They would like good things to happen for others. So may God bless all be having Bhadra Pilasha and all have good happenings in life. Namaste.